Attack on Titan, Demon Slayer damage, and plenty of other intense anime injuries that's sure to make your head spin. Today, we're breaking down and reacting to all of the fiery medical scenes and fierce injuries from some of your favorite anime face-offs. Let's dive right in. Looks like the knife just missed, but if that knife got embedded into the foot, what do I always say? Don't pull it out. Are you likely going to bleed out from a foot wound that distally? Not necessarily, but you will have a bleeding. So it is something that you need to pay attention to. Ow. Face right into a rock. We will assess their neck. Look at that neck. Can you break your nose? Yeah. Does it happen every single time somebody smashes their face on it? No. Most of the time, it's a crack through it and it just sits in the same spot. Ooh. What the heck is going on? Come on. Come on. Scissors coming out like a splinter. Probably were subcutaneously placed, not on the other side, like swallowing. You wouldn't be able to pull them out. Getting hit in that posterior left calf. It's a lot of muscle, some nerves running down that area, some small blood vessels, but mostly muscle tissue. That's your gastrocnemius. That's the one that looks like a little heart. Attack on Titan. Oh, darn. We actually see amputations like this when people are using lawnmowers, even people cutting wood. Perfectly clean wound. There is a potential chance to replant this. Grab the pieces when you go to the hospital and try to get the bleeding to stop. Lacerations to the Achilles tendon. That big thick tendon on the back of your ankle attaches to the calcaneus, and that is the attachment of your gastrocnemius and your soleus. If it's cut, you're not going to be able to lift off of your foot. Ooh, swallowed a sword. I've seen shows where people swallow the sword, but typically not going towards the hard palate, going straight through down the esophagus into the stomach. There are some special, unique people out there that are able to do that. But at this angle, you can crack through the hard palate, go straight up through behind the eyes into the brain. Typically, that is not something that is compatible with life. Ooh. Just nearly missed the eye. It shows it actually has a flat surface, but if you look at your own eye, the cornea itself is very clear cells that make it round and stand out. Might have grazed the cornea, causing a lot of pain. It will typically heal, but if it gets any deeper and goes into the anterior chamber, then you run into issues where you're going to be leaking out fluids. You need to see a specialist. That arm just got chopped off. Mid bicep, the right arm is gone. You're gonna have significant bleeding, major arterial bleedings going on. It is a very clean cut. There is a chance that you can actually have it replanted. You most likely need a proximal tourniquet. Soft tissue injury straight through just past your mandible. Here, we can all feel that soft area. It actually goes up through where you have soft tissue in the mouth, where some of the ducts are for salivary glands. Might miss your tongue and just comes right through there. So it is just a soft tissue injury. It looks very dramatic, but it's actually not that bad of an injury. Whoa. Not compatible with life. Maybe for a split second, there could be some movement or consciousness, but then it is gone. Oh, working out at the gym. Check this out. This reminds me of Rocky IV when Ivan Drago is at the gym. He's got all the electrodes on him. Oh, there you go. Do we have serums like this that we can just drink? No. There are steroids, growth hormones that people take inappropriately. People will say, okay, what about like testosterone? The likelihood that that's going to cause you to get this big is pretty low. Oh, huge. Almost like Godzilla type size. I didn't realize how big this person was. If you had one punch to throw and it had to be the most damaging, understanding normal human physiology, the solar plexus, right? But that's just the epigastric area.
Traumatized solar plexus.
Airway, that's another, right? So you may not need to punch them, but more like karate chop that area. overslapping the ear itself potentially can rupture somebody's eardrum.
Discombobulate.
I always get concerned about the middle meningeal artery, which if it ruptures, it can cause somebody to have an epidural hematoma, which is pretty dangerous. Naruto. It's like the airport in Japan. Little puncture wounds to the left side of the face that will come right out. Typically, if we see that on someone's face, is maybe about 1 centimeter. You're gonna get 2 or 3 stitches. You only need the stitches in your face for about 5 days. Oh, look at that wedge of ear just taken right off. Taking off a piece of cartilage. Cartilage does not have a good blood supply, so this needs to typically just get sewn up of the skin that is left on each side. Mid-thoracic or right at the lumbar area can cause significant amount of trauma, fracture the bones of the spinal column like your spinous processes, or even have exploded vertebral bodies. The concern is always the integrity of the spinal cord because the bones there are there to protect and give us structure. Could lead to paralyzation if the spinal cord is injured. His weapon buried into his abdomen. We got another like pole through the chest. This doesn't seem compatible with life. Midline penetrating trauma, probably going through the mediastinum where your heart is. Heart might be hit, and then the big blades going into the abdomen most likely will cause significant amount of bleeding, hit your intestines. Kick to the face, smashed in. Woo. We don't see too many facial kick injuries unless somebody's down on the ground. Most of it is soft tissue injury, but we do see some fractures that need to be evaluated for the potential of needing surgery versus will they heal on their own. Oh, hold on. Adrenaline, muscle tightness, brain fully locked in like you're in one of these fights. And that's exactly one of the reasons I created Chillax by my company Life Happens, designed to help support relaxation when your body's stuck in that high alert mode. Check out Chillax at lifehappens.com or on Amazon. Oh, face is literally smashed in.
Literally?
This could actually happen. There's something called Lafort fractures. There's different degrees of the fracture to the mid-face. They're actually pretty dangerous. There's a lot of structures underneath that. Increase the risk of an infection going into your brain. Oh, we're missing some teeth. Missing a lot of front teeth of the maxilla. You worry in the ER if somebody's missing teeth traumatically. Did they swallow them or did they go in their airway? So we'll typically get an image. And then if we don't have the teeth, we can't replace them. So unfortunately, this is going to be a follow-up with a transplant specialist relating to teeth. If you do have them, sometimes we can put them back into place. We just have to make sure it's the right tooth.
Do you have my teeth?
Very interesting. A lot of things actually translate to what we deal with on a daily basis in the emergency department and some rare things that we do see. But if you guys enjoyed this, definitely check out this playlist right here, binge watch everything. And as always, do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.